We are very fortunate to have with us this morning a long-time friend and a long-time supporter of our college and our health administration programs, Mr. Greg Neal, President of Bristol Regional Medical Center. Now, I say a long-time friend and supporter because Greg may not remember this, but I remember it very well. Back in 2010, when my late colleague Tim Baylor and I were envisioning the breakfast with the expert concept and thinking about who we want to invite to be part of the program during its first year, because the first year obviously is very important to establish the legitimacy and the relevance of the program. So at that time, we quickly thought of Greg Neal, and he was one of our inaugural speakers. And this summer, when I thought about who might be best prepared to share with us key developments in our healthcare system, particularly in our region, Greg Neal again came to mind, and within 2 minutes, literally within 2 minutes, he had accepted the invitation to be with us this morning.
What does that tell you about my social calendar?
It tells me about your work ethic. That's why you were here at 7:45 this morning before any of us arrived. So that's what it tells me about. So between 2010 and 2016, I have had the pleasure to experience Greg Neal as a field preceptor for our students, as an advisor on our professional advisory committee, as a guest speaker in our classes, and as a connector who has connected our students with field experiences and with employment opportunities. During this time, I have also had the pleasure of watching his career flourish and grow within the Wellmont healthcare system. When we first met, Greg was the Chief Operating Officer of Bristol Regional Medical Center. He was quickly promoted to President of the Community Hospital Division of the system, and more recently to President of Bristol Regional Medical Center, one of the largest and finest healthcare facilities in our region and in our state. So we are, again, very fortunate and privileged to have Greg with us today, and let's please welcome him and hear from him.
Thank you so much, Dr. Curry. It's a great honor and a privilege to be here this morning, and it's a privilege to have so many of you show up. I don't know if this was mandatory for you or not. If it was, then good job getting here. If it was not, if you're just here on a voluntary basis, then I'm really humble. Thank you for coming out, and I hope that you'll find at the end of the hour that it was time well spent. I have had the privilege to have some association with the college, and I really want to congratulate you, Dr. Curry, and your colleagues for the fine program that you're developing here at ETSU. I have the pleasure of serving on the advisory board as well, and I've been very impressed with the development and maturity of the program, the curriculum, and know that you guys will be well prepared for whatever you choose to do in your career pursuits. And if I can ever be of any assistance to you, I'd be delighted to have the opportunity to do that. Well, this morning, Dr. Curry said I could talk about anything. So that's actually more of a challenge than giving me an assignment. I don't know if you guys find that to be true. But she asked me not to reinvent something, so I didn't. I'm here today to share with you a little bit about the journey that we've been on at Wellmont Health System for the last over 2 years now. I guess it goes back as much as 3 years. This journey to discover what the future is going to hold for us, and how are we going to be able to create an environment that allows our health system to not just survive, but to thrive for generations to come. We have a very long, almost century long in some of our communities, situations where hospitals have been providing excellent health care in those communities for that long. We want to make sure that we're here to serve the next generation and the generations after that, and that folks have a place not just to get health care, but to work and to grow personally and professionally. And so that's a little bit of the genesis of why we started down this journey. I'm calling here the Sustainable Health System of the Future, from competition to collaboration. It reflects the environment that we operate in today, and we continue to operate in today. It's a very competitive market. If you're from this area, some of you maybe even work for Wellmont Health System, or have in the past, or for Mountain States Health Alliance, and obviously you're very familiar with how competitive the market is, and that's a good thing. I'm very much a market-driven guy. Capitalism is, I think, a beautiful thing. The interesting thing is that I think that's what makes horses run. If you watch horses in a field like we have around our house, horses by themselves just kind of stand around, right? They eat a lot of grass and get fat and lazy. But you put some other ones out there, and you see them begin to compete, and that makes them better, stronger, faster. And I think that's true in our market as well. But the environment's changing, and it's changing in dramatic ways that require us to think about how we're going to do business differently. And so let's talk a little bit about that and the journey we've been on. It goes back to 2013, like I said, when the Wellmont Health System Board of Directors began to contemplate how to create this strong future. And the focus was around, ultimately became around evaluating the potential for some alignment partners, recognizing that with the decrease in reimbursements, the increases in costs, we were on a trajectory for what would eventually be a going out of business scenario. When you get upside down on financially, you're just going to have to look for ways to get your ship in good shape. So we felt like it was really critical in this kind of environment to get bigger, to get scale, so that we could find economies of scale. We would have the opportunity to get better pricing with our suppliers. If we can become more financially stable, we can get better terms in the financial markets and those sorts of things. So scale was very important, and it was a priority to evaluate potential alignment partners. And alignment is kind of key here. We really didn't know what that meant. Lots of different alternatives for strategic partnerships and alignment, but we needed to find somebody that could align with us. We wanted to share and gather information to more completely understand what was important to all of our stakeholders, the communities that we serve, our patients, their families, the employers in the region, the payers in the region, as well as our employees, of course. And then protect the deep commitment to what's in the best interests of the folks in our community, so that we have, as I said before, a strong health system that's going to be here for generations to come. And so what led to that was really this question here: could Wellmont Health System remain independent as we are today and continue to fulfill our mission and vision in the future? Our mission is to deliver superior health care with compassion. That's the reason we exist. And obviously, there's an old saying. I think it was one of the nuns in the Catholic system that said famously, "If there's no margin, there is no mission." So, seeing our margin diminishing, we needed to ask ourselves some hard questions. And so some of the statements that came from the discussion with our board was that we believe Wellmont's must thrive, not just survive. We believe Wellmont must lead, not follow, and we believe Wellmont must act, not simply hope for the best. You know, we could have stuck our head in the sand and hoped for the political winds to change and somebody to come in and decide they're going to start paying us more as providers, but I think that would be a recipe for disaster. So the commitment of our board emerged that we would begin this journey, and as a group, I commend them. These are volunteers that serve on we are a private, not-for-profit health system, so all of the members of our board of directors serve as volunteers, and it's a huge commitment to undertake to serve on a board in the best of times, but to undertake the kind of responsibility they did in this season of our organization was enormous. And literally, I think we probably at this point could revise that number easily to thousands of hours that have been invested by our volunteer board. Lots of research on our own, as well as from other experts around the country, talking with other health systems, and so much more that's gone into this. A little bit more about why the need for change, some things that were driving the economic pressures that we were under. Was, as I mentioned, the decline in reimbursement for all health systems and providers across the country. But we in this market are particularly hampered by what is the third lowest area wage index in the country. So if you guys are familiar with the way that works, but not every hospital in the country gets paid the same by Medicare. They adjust that based on the geographic region that you operate in, and in their infinite wisdom, they've decided that we should be paid lower than the rest of the country. I think West Virginia and Puerto Rico are below us in reimbursement. So I assure you that our costs aren't materially different, but hospitals operating in states like California, Illinois, New York are literally getting paid twice what we get paid for encounters on Medicare patients, which make up 55% of our business. Another a significant portion of our business comes from Medicaid, TennCare in Tennessee, Virginia Medicaid, so that equates to 2/3 of our business, of our revenue, coming from government sources with whom we don't have the opportunity to negotiate rates. Those are dictated to us, and they're dictating that they're going to pay us less and less. And they have been for the last several years, and that's written into law that it will continue to decline for the years to come. So that's driving some really significant turmoil in the industry, to the point that at the time we started this journey, 87% of the hospitals in the United States were either merging or considering merging with other providers. So the reality is, other realities that are going on is that we've got less utilization as more financial responsibility is being placed on patients for their health care. It's leading to changes in the way they utilize health care. Fewer patients in our hospitals, more care being shifted to outpatient services and other ambulatory locations. We're having to shift our thinking from being paid as well based on how many encounters we do. Historically, we've been paid based on how many patients come to the hospital, are admitted to the hospital. If you come for tests, surgeries, you get paid for what you do. We're in a transition now, but on the other side of this transition is going to be a market where we're paid for value. You're paid really to decrease the cost of health care. So our incentives are to keep people healthier, to keep them from being readmitted to the hospital, to keep them from being unnecessarily admitted in the first place. So you see a troubling situation here. We're getting paid less for every click that we do have, and then we're being incentivized to make sure there are fewer clicks to begin with. So dramatic decreases in reimbursement. I spoke to this, the consumer-driven healthcare driven by high-deductible health plans. Some of you may be in an insurance plan that has high-deductible plan where you're out of pocket for 3, 5, some plans around here even as high as $10,000 before the insurance ever kicks in. That forces you to make some very hard decisions about where you go for health care. And I mentioned the area wage index. So you can see the decline in discharges in the region. Over the 3 years, we saw utilization decline 10 to 12% in that period. This is Wellmont's snapshot of what the financial situation that Wellmont was facing at the time we started this journey, where our operating income dropped from nearly $23 million in 2010 to right at $5 million in 2014. I'll tell you that in fiscal year 2016 just ended, we budgeted for a break-even operation. We were able to do a little better than that, not a lot better, but we operate on razor-thin margins, less than 1%. I challenge you to find another business where they consider that a good year to turn a 1% margin. All that change, or that dip in operating income, operating margins, was even after we had cut $60 million of cost out of the health system in a 3-year period of time. So looking at the future, we knew that we needed, if we're going to be sustainable, if we're going to thrive, not just survive, we needed to create margins in the neighborhood of $20 to $25 million every year to be able to fund the capital investments, to keep our facilities in the condition they need to be, to invest in the technology needed to provide the scope of services that we provide. Must maintain at least $300 million in reserves. We have debt. Our bondholders require a certain level of financial management, and one of the requirements that they put on us is to maintain $300 million in reserves, or it triggers some very bad things like higher interest rates, or eventually even taking over management of the health system. So we needed to fund $30 to $40 million in capital every year, and we have limited capacity to take on additional debt. So the vision emerged to ensure that we are vibrant and relevant in the decades to come will require thinking, acting, and serving in very different ways. We can no longer just trim around the edges, tighten our belts, try harder. We had to fundamentally rethink our business model. And so that vision began to take shape, and that decision to align with a like-minded health system. By doing so, Wellmont would have the scale necessary to advance clinical excellence and to continue providing our community with superior care. So these are some of the priorities, the goals that our board felt were essential to be able to invest in our expert professional staff, making significant facility improvements, implementing the technology that we need to provide the level of care that their communities expect, to be able to recruit and retain physicians, particularly providing primary care access, which ETSU does so well in training those professionals. We need to be able to provide them with jobs and be able to put them in the market, but specialists as well, in developing best practices in healthcare. And a real goal here is we wanted to not shrink our way to greatness, which is a temptation in a situation like this, but we wanted to be able to create the economic engine that would allow us to grow and to invest more and be a great employer that would attract the best, brightest, and best talent. So there's a question that we had to ask ourselves too: why would somebody be interested in us? What does Wellmont bring? What would Wellmont bring to the table in a potential alignment for this? If we want to attract a like-minded partner, obviously it's got to be a win-win. And so these are some of the things that we feel are particular differentiators for Wellmont that would make us attractive. And in fact, it did. We had, when we put out an RFP to see who would be interested, we had about 30 responses from major health systems all over the country, for-profit, not-for-profit, region, from the southeast, as well as from all over the country, which is kind of interesting. But we know that in Wellmont you're going to get strong clinical quality. We deliver superior health care, and I'd say in many respects you won't find better health care anywhere. We probably have some folks in the room that could give some testimony to that. I know we do, actually. But so we have excellent physicians and professionals, a remarkably high percentage of board-certified physicians who achieve the highest level of training in their field. We have a great physical plant, technology that surpasses things you'll find in many major urban markets. An $800 million organization that would bring needed scale to someone else as well. Become part of a larger population health management strategy, which we're developing expertise in. And then this last one I'll highlight, efficiency experts. When you live in the kind of market that we do, with the sort of unfavorable payer mix and low reimbursement, it's essential that you be a low-cost provider if you're going to survive. So as we benchmarked with these other health systems across the country, one thing that they told us consistently was, wow, you guys are lean and have a high level of productivity, and we probably could learn something from you. So that's something that we could bring to the table. So the guiding principles that sort of set the stage for all of these potential partners to understand going into this was that they needed to be fully committed to our mission and our values. They needed to be recognized for exceptional clinical care. They need to have the financial strength, obviously, to make us better and to be able to help us invest in the things that we've already talked about. They need to have experience and expertise to develop innovative ways of delivering care. They need to be committed to a robust physician network and to physician leadership. That's something that we're particularly proud of in our organization, is that we like to say we're physician-led and professionally managed. So in my hospital, one of the primary tools that I have for making strategic decisions and tactical ones is something called the Physician Clinical Council. I meet regularly with about a dozen physician leaders, and very transparent with them about challenges that we face, and we present the data, and they help us get to good decisions. So that's not, I think that's becoming more common, but it hasn't always been that way for sure. We wanted to make sure that they're a good employer and committed to the growth of our system, not looking to just, like I said, take jobs out of the community and move them to some other corporate center, and be a good citizen in the community and have a vision for being a community partner. So these are some of the key questions we asked them. What's their commitment to our charity care policy? How much are they willing to invest in the market? What kind of experience do they have with new alternative delivery models? Their commitment to what's their reputation in their own system with their physicians and their employees. The commitment to, again, helping us develop the economy in the region. How they feel about our community benefit programs. Really, all that coming back to the heart of, do they share our mission? That we're here to deliver superior health care with compassion, as opposed to, are they here to maximize shareholder value, perhaps, or some other, a different kind of mission. So that brings us up to just 2 years ago. I think I need to swim faster here, but we've got 2 more years to go. But actually, at that time, we were able to narrow it down from 30 to 12 to 6, and finally, in the fall of 2014, we narrowed it to 3 potential system partners. 1 in the local region, and 2 that were from outside of the market. And the more we talked, the more excited we became about the prospects of this being a successful strategy. We began to have conversations in the community with all the stakeholders that I spoke of, and And what emerged from those conversations was this this number one criteria for selecting the best partner was a commitment to making high quality clinical care the highest priority. And so obviously there was much work to do yet. Here's some of the kinds of conversations we had at that time. If we updated this today, you'd see much bigger numbers. Created a website dedicated to communicating to our staff, to our physicians, to the community, try to quell rumors. It's incredible when you go do something like this, the kinds of rumors that you hear. Is like every day I was fielding some kind of off-the-wall rumor that decisions had already been made, and it was very interesting. But anyway, that brings us up to just a few months later, and about around April Fool's Day. We intentionally tried to avoid having a press conference on April Fool's Day, but that's when the decision was announced that the preferred partner, the partner with whom we would initiate exclusive negotiations with at that point, was Mountain States Health Alliance. And this concept of better together emerged. And so the transaction that was proposed and continues to be our plan through today is that our two systems agreed to exclusively explore the creation of a new, integrated, and locally governed health system. We'll come back to that. Designed to be among the best in the nation and address the serious issues that affect our region. I think that locally governed was probably as significant a factor in our decision to choose Mountain States as our potential alignment partner as anything. Other potential partners in every respect, it was clear the nucleus of decision making was going to be somewhere else outside of this market. And it was really important for us to maintain the ability for the people that live here in this region, that are invested in this region, or have the seats at the table to drive the decisions that are going to influence the way healthcare is delivered in this region. We also want to make sure any value that was created stays here in this market, as opposed to flowing to support the corporate overhead, if you will, of some other health system outside of the market. Definitely benefits to those types of relationships, but this, I feel like, was a overriding factor in this decision. So it was an opportunity for us to come together to build something brand new that reflects what our community really needs. So this is a point that has been repeatedly challenging to get through to folks, is that this is a merger of equals. This is not a takeover. Wellmont Health System is not being acquired by Mountain States Health Alliance, nor is it the case the vice versa. Even to this day, I have employees that I have to remind them of that case. But we're creating something brand new, putting our organizations together. The executive team will include representatives from both organizations. The board of directors is going to be made up of folks, an equal number of representatives that currently serve on the Wellmont board as those who serve on the Mountain States board, along with 3 new members, including Dr. Nolan. The president of ETSU will be an ex officio member of the board in a non-voting status. So the vision that came together, yet another vision, this one being a shared vision of our two organizations, was that as a combined system, we'll unite the resources of both systems with one common purpose: to make the next generation of this region healthier than today's, and to make sure those who need healthcare services today can access the best care available in the nation. So just parenthetically, I'll say that I think that this shift in the way we're delivering healthcare, this focus on being centers of population health, that our mission being to make the region healthier because we're here, is a great move for your program, and being a public health centered program at its core. You're going to have the expertise. Your training folks are going to have the ability to influence healthcare in the future like they never have before. So it's an exciting time to be, I think, in a public health with Health Services Administration focus. So there were several areas of commitment that we had here that the joint boards put out. We wanted to ensure that our new system would be uniquely able to provide people that we serve with even more accessible, more affordable health care. We wanted to aim to be among the best health systems in the nation. Want people flying into the Tri-Cities Regional Airport to, regularly to visit our hospitals and our system to understand how we've done this. We want to be one of the most attractive places in the country for folks who want to work in a very high-performing organization, whether clinically or otherwise. We want to be able to partner. We want to be able to have the infrastructure to partner with physicians and clinically integrate in ways that we haven't been able to in the past. And obviously be able to achieve long-term financial stability, sustainability that would come through the efficiencies gained from the new organization. So those are all great visions and great ideas, but how do you make it happen? And this is, I think, there's a number of case studies that could be developed just through this consolidation alone, or this effort to consolidate. And it's certainly been a learning experience for, I think, both of our health systems. It's been an experience for the state of Tennessee and the Commonwealth of Virginia as well, because we're plowing ground and creating something that's never been done before in either state. And so we're coming together in a unique way, rather than just do what folks traditionally would do, is just have a press conference one day and announce that we've merged, or you might have a press conference announce that Wellmont Health System has been acquired by XYZ health system, and we go on about our business. In this case, with a local merger like we're talking about here, we're talking about something that significantly reduces competition. And there are regulators at the federal level and state level that pay very close attention to anti-competitive moves or things that reduce competition. So it was critical for us, in order to avoid being dragged into federal court by the Federal Trade Commission and forced to unwind this, that we get what's called state action immunity. This is there are statutes, I think, in almost every state. It's the policy of the Federal Trade Commission, effectively, to yield to the to decisions that are made by state government when the process ensures that the reduction in competition is offset by the benefit that will be gained as a result of it in the communities that are being served. So that's the journey that I'm speaking to here. And in Tennessee, that process is called a Certificate of Public Advantage. In the Commonwealth of Virginia, it's called a cooperative agreement, I believe is what they call it there. But basically, a Certificate of Public Advantage authorizes us to merge, and directs the state to have an active role in supervising this new organization to make sure that we are delivering the benefits to the communities that we serve by providing care that's affordable, accessible, cost-efficient, and high quality. In other words, we're not able to use that market power, if you will, to decrease access, to allow quality to slide, or to jack up prices in any uncontrolled fashion. So that was enabled through some legislation that actually had to be created in Virginia. It was in July of 2015, and then in Tennessee, the law had been on the books for something like 35 years, but had never been utilized. So they had to update that statute to make it possible for us to go through this process. At a local level, the health systems created this integration committee and a joint board task force that began the actual work of solidifying the partnership, all of the legal documents necessary, working with experts, because keep in mind, we are competitors still, and there are also a lot of folks interested in making sure that even in the process of talking about consolidation, we don't violate any anti-competition statutes. So it's every conversation that we've had since the beginning of this journey is required having attorneys in the room to make sure we stay on topics that are allowable to discuss. And so some of the things that we've been working on here, and then continuing to engage with all of our stakeholders, keeping them informed what we're trying to accomplish here and why it's in the best interest of the communities that we serve. We're blessed that we have had overwhelming community support. The university's been an outspoken supporter from the beginning. Most all the major employers in the region have gotten behind the effort. Our legislators are supportive and trying to be helpful and making sure that we create something that is going to deliver what we say it is. But we continue to stay engaged, and I would encourage you to check out our website. We've been incredibly transparent through this process. Every consultant that's worked with us has said this is something very unique that they aren't accustomed to seeing, is the level of transparency that we have here. You can go to the website. It's called becomingbettertogether.org, and that's where you'll find information. All right, so it brings us up to where we were in the journey just earlier this year. Back in January, this timeline that we had been on, of course, we've already talked about this activity brought us up to the winter of 2016, where we were required by the statute to file this public, what's called pre-submission report, to sign the definitive agreement, which is necessary to file the application. And then we filed the actual applications in Tennessee and Virginia, and we expected that the reviewers would just be thrilled with the application, and they would look over it maybe over the weekend and give us approval on Monday morning. I'm just kidding. That's not what we expected. We didn't anticipate that they would be as thorough as they have. What we expected them to. The process requires them to, once they get the application from us, is to review it, make sure they're satisfied that all the information that they need to make a good decision is there. And when they've done that, that's called deeming the application complete. And per statute, when they deem it complete, they go on the clock, if you will. So in Tennessee and Virginia, once they deem the application complete, they have 120 days to make a decision. So we were obviously hoping that they would deem it complete pretty quickly, so it would be on a very predictable timeline. So we filed that in January, and then the months started dragging on, and I'll come back to that in a moment. But the pre-submission report is available for your viewing as well on the website that I mentioned earlier. The highlights of that, it was the result of a lot of research and work, and then commitments in 6 key areas that I think are really critically important for anybody that lives, works in this region to be familiar with. Why you should be comfortable that this consolidation is a good thing for our market, and the benefits of it outweigh the benefits that might exist from continuing the competitive environment that we work in today. But it includes some very significant investments that I'll speak to in a moment. So what are those commitments? The 6 key areas include improving community health, enhancing healthcare services, expanding access, improving healthcare value, managing quality, cost, and service, investing in health research and graduate medical education, and attracting and retaining a strong workforce. So I'll unpack those a little bit. So what do we mean by improved community health? Investments that we're making there amount to $75 million over 10 years in programs to address common health issues in everyone in the region, children and adults. Things like creating strong starts for children to life, living well in the community, promoting a drug-free community, decreasing avoidable hospital admissions and ER use. When I say commitments, I mean commitments. These are not promises. They're not, we're going to try real hard to do this. If it is in the Certificate of Public Advantage, it's a commitment. It's an obligation that we have to the state. And if we don't deliver on it, on these commitments, they have the authority to force us to ultimately to unwind. They force us to honor our commitment. So these things will happen if our health system is allowed to merge. Enhancing healthcare services. That investment amounts to $140 million over 10 years in developing new specialty services that are needed, notably in behavioral health care, providing access to crisis management services, which is a huge need. I can assure you, my emergency department every day, and every emergency department in this region is filled every day with folks who are just waiting on placement into a program where they can get access to the behavioral health services that they need. The pediatric services. Niswonger Children's Hospital has done a remarkable job of developing, and we need to expand the reach of access to the subspecialist care particularly, and create dedicated facilities for children in our larger markets. And then work to make sure that we're meeting the staffing needs in underserved and rural areas. A great partnership we have with ETSU can help us deliver on that. The third commitment, expanding access and choice. This is a critical one for a lot of folks internal to the health systems for sure. You know, there's a lot of concern about what does consolidation mean, and is there going to be a reduction in services in one place or another. Well, the commitment is that we are going to maintain 3 full-service tertiary hospitals in Johnson City, Kingsport, and Bristol. So, defining full-service tertiary hospitals is something obviously we've got to invest some more work in, but I think it means intuitively we're going to do what we're doing today in terms of the scope of services that are available. We're going to repurpose for sure some current facilities. The idea is to eliminate unnecessary duplication. It doesn't make a lot of sense for us to have urgent care centers across the street from each other, for example, to have competing full-page ads in the paper promoting the same service that's very expensive. So we're going to value a robust and successful independent physician community. That's a concern from a lot of physicians in the region. They want to know that they're going to have the opportunity to continue to practice the way they want to. And so we want to work with them to make sure that happens. And then improving healthcare value. We're going to reduce the pace of healthcare cost growth by placing limits on negotiated rates with insurers. So I mentioned to you earlier, one of the concerns obviously of a monopoly would be the power to drive up costs, to increase prices. That's been a concern we continue to hear from people who haven't been paying attention, I think, to what our commitments are in this COPA. But that can't happen in this merger because we've committed to putting a brake, if you will, on our ability to have price increases and negotiate price increases with payers. It's going to be limited, actually, right out of the box the first year after the merger. Whatever inflators we already have in our contracts will be cut in half for that year. And then going forward, we've agreed that we will never ask for a price increase greater than, I think it's the medical component of the Consumer Price Index minus 0.25%, I think it is. So definitely a lever on our ability to see prices increase in the market. We're going to invest heavily in electronic medical records and health information systems to get on a common platform across the market, so that if you go into a physician's office in Johnson City, or you go into the emergency room at Bristol, or you have surgery in Norton, Virginia, the physicians, the providers are going to have access to all of your information. And that's a good thing for you. We're going to develop these collaborative approaches to improving health outcomes and working an opportunity to have innovative relationships with payers. Some of our payers are actually very excited about this merger and the opportunity to do some very unique things in the market. Next commitment is to expand health research and graduate medical education. Obviously of key interest to our partners here at ETSU. The new health system is committed to investing $85 million over 10 years to support academics and research, partnering with universities around the region to develop and grow academic and research opportunities, supporting more postgraduate healthcare training, more residency slots, more fellowships for what are already there, and even new programs that don't exist today. We need that to be able to strengthen that pipeline to provide the caregivers that we're going to need in the future. All right, I think this is the last one, not least, of course, is to attract and retain a strong workforce. We want to be an amazing employer, an employer that folks really on a national level want to seek out opportunities to work there. We're going to continue to provide competitive pay and benefits, which is a challenge. As your reimbursements are declining, the biggest component of our cost structure overwhelmingly is our people. And it's challenging to be able to provide the best benefits and to be able to offer raises on an annual basis. We want to be able to do those sorts of things, and we're committed to doing that. In this transition, existing employees will all come with all their accrued benefits that they have in place. We're going to honor their years of service. We're not interviewing people for their job or anything like that. And it's really, this is an exciting part here, I think, combining the best of each organization's career development opportunities. I've been here 25 years in this market. I came here after finishing a program similar to what some of you are in, a master's in healthcare administration. I came here to do my field experience, I think you call it, administrative residency. I thought I'd be here for a year and then having to travel around the country, work somewhere for 3 or 4 years, and then seek another opportunity geographically. But I've been able to stay here and for 25 years, my entire career, working in the same organization because it's grown. And it's grown because of a merger. Wellmont Health System didn't exist when I came here. Mountain States Health Alliance didn't exist when I came here. I came to work at Holston Valley in an independent hospital, and but soon after I got there, we merged with Bristol Regional, created Wellmont, and as the health system has grown, it's created opportunities for me. And I'm a testimony to what what a merger can do and what growth can do in terms of career opportunities. And so I'm particularly excited about what I think is going to be an explosion of career opportunities for people that want to work in this area, no matter what your field of interest might be. So that's the I guess in a nutshell, the commitments. But it's important to recognize that this is a different path. I spoke to that earlier. The path that we're on is really noted for this state oversight. That's really unique. And through the cooperative agreement, the organization must be approved by both states. And then, again, actively supervised by both states forever, if they choose to ensure that it benefits the community by providing the things that we're promising here. The alternative, no enforceable protections for the community if we were to just be acquired by some other organization. And then, again, it's a health system that's uniquely designed for our region. that local leadership, that local governance that ensures that we're creating efficiencies and that are going to be reinvested right here in expanding services, improving access, and addressing all the concerns that are uniquely present in Northeast Tennessee and Southwest Virginia. The alternative, again, no accountability at all. An outside health system would be free to take whatever savings and efficiencies we create and plow them back into wherever their hospitals are in Texas or wherever that might be. They'd face no requirement or local accountability to make the investments that we're talking about. So we think it's a better approach. Obviously, it's the only model that maintains local governance, provides an enforceable commitment to limit pricing growth. It keeps, like I said, hundreds of millions of dollars in this market invested in things that we know we need in improving the health of the folks in the market, and also preserves jobs. A lot of folks are concerned in a merger about jobs, and I would suggest to you that the risk of job loss is probably greater if we don't do this than it is if we do. This creates a sustainable system that will allow us to create jobs and grow. The alternative is going to mean continued challenges in figuring out how we're going to tighten our belt more and more every year. So where are we today? I guess I worked on this a couple weeks ago when it was September, but so where are we today? As a combined system, we're going to make this happen. We're still committed to that. Our timeline, as I mentioned, had to slip a little bit because the Department of Health in Tennessee and the Virginia folks have taken a little more time to ask a lot of questions, which is great, making sure that our application is strong as it possibly could be. But it was not until just in the last 30 days or so that both states have finally deemed our application complete. In Virginia, that happened. The Southwest Virginia Health Authority, who's got delegated responsibility for evaluating our application, they deemed it complete on August 26th. And so now they're engaged. In fact, last night in Abingdon, Virginia, they held a forum for public comment on the merger. Ultimately, the health authority's job is to make a recommendation to the Virginia Department of Health, and then within 120 days, the Commissioner of Health, Dr. Hazel, will have to make a decision whether we're good to go or not. In Tennessee, review of the public, the COPA, Department of Health deemed the application complete on September 15th, so that got that clock ticking. So do the math. That gets us into mid-January when we would expect to have the disposition from the two states as to whether we're going to be allowed to proceed or not. So mentioned local governance. Well, who are those people? And here are their names, and they're in no particular order other than alphabetical, so don't read anything into why are there two Mountain States people first. It's just alphabetical. And if you count, there's an equal number of folks from the Mountain States Board, equal number from the Wellmont Board, and then 3 new members, which include David Golden, who's the Chief Legal Officer at Eastman Chemical Company, Scott Neiswanger, obviously at Land Air down in Greenville, and then Dr. Nolan is the ex officio member for ETSU. And then there's been obviously a lot of work ongoing. We're doing everything we can do as competitors still. We've created what we call functional teams. We have 18 of those. I work on a couple of them. One related to hospital operations, but there's equal number of leaders from the 2 health systems working together. And it's actually been a very enjoyable experience to be able to work with my colleagues at Mountain States and doing the work needed to make sure that the transition and the integration goes off as smoothly as possible, assuming that we're approved. And I mentioned earlier, always with those lawyers watching over our shoulders to make sure we behave ourselves, and, which I appreciate because I don't really want to go to jail over this for sure. So the name, Ballad Health. Some of you, hopefully all of you by now, have heard that this is been suggested as our new name. And I don't know if you're like, I was in New York City at the time when I got a text to tell me that was going to be the name, and I was like, huh, that's interesting. Wonder where that came from. So probably many of you have had this similar reaction. Most people I've talked to have. Some immediately love it. Some immediately think it's crazy. And but for most folks, it's something that just have to let it marinate a little bit. And I've come to really like it. I think it's a great name, and I'm going to tell you a little bit about how that name came to be. But one thing I'll tell you is, I don't know if you've ever been through this process, but trying to select a new name for any kind of organization is incredibly difficult to do. I mean, I bet if we brainstormed 100 names here, 99 of them would be legally protected, and we couldn't use that name anyway. So it's important to, that's why oftentimes you find organizations are just making up a name that doesn't mean anything, and you take some syllables and throw them together and create something. And we really didn't want to do that. We wanted something that really represented the culture of our region, but that was different. And so in this case, the Ballad Health sort of emerged as a reflection of trying to connect to the history and heritage of the region. Obviously, storytelling, music is inherent in our culture. One thing that really emerged is listening to our patients and what's important to them. Listening to our region as we did, and talking about what's important to them in the new health system. What we hear over and over and over again is that they assume they're going to get great quality health care. What's important is to have a relationship with a provider, with a health system who listens to them and allows them to be part of the conversation in making decisions about their health care. So if you look up the definition of a ballad, you'll find in a nutshell it means a poem or a song that tells a story. And it's usually a story that's passed down generation to generation and just becomes part of the culture. So begin to see the connection to our region's heritage and storytelling and music, and our patients' priority on us listening to their story. And so Ballad Health emerged in that way. So I want to share with you just a little clip that I think tells the story probably better than I can. If I can find it here real quickly. Yep. You like it a lot better now, don't you? I hope so. I do. Uh-oh. There we go. All right, so Ballad Health, that's who we're going to be. And with this new name, we're making, I think, a cultural promise to you and to everybody in our region that we do intend to listen carefully to your story, to be able to write a future that's better than what we've had before. So, obviously we've received a lot of input that also helped feed into the name, and it is different because we want to be a different kind of health system. And I think I've spoken to these points. But so the key takeaways today here is this, I think, is that we are making significant progress in this journey toward transforming the way we deliver health care in a way that will be sustainable, that'll be here for our children and grandchildren to be able to access superior health care with compassion, and to be able to also be an economic driver in this region as we're able to fuel growth. The research and academic investments that we're going to make will have far-reaching effects far beyond just the delivery of health care, but in the development of the economy in our region. We've worked exhaustivly, I think, with folks in both states, Tennessee and Virginia, and we're really proud of the story that we're able to tell them. We feel like we're getting a very fair and appropriate hearing, and they're doing everything they can to ensure that this stands up to whatever scrutiny any federal regulators might throw our way. But we're not done yet. The journey's not finished. It'll go at least through the end of January. If we get approval from both states there, then really the real work only begins. It's kind of daunting to think that, but we expect to be able to close the transaction very quickly, maybe within 30, 45 days for sure, after we get approval from the two states. So that would have us potentially March 1st of 2017, just 6 months from now, being able to do business as Ballad Health. And we'll be here very quickly. Both systems obviously very committed to this, but importantly, today and until we are Ballad Health, we remain competitors, obviously until that point. And so behaving as competitors is what you should expect to see from us over the next few months. Okay. Well, I think that's my last slide, but be happy to, Dr. Curry, I don't know if you have time to.
Yeah, we do have time for a couple of questions, but let's first give Mr. Neal. Thank you so much. This was very informative. I actually got to hear the story of the name over the weekend during a soccer game from one of your board members.
Okay, great.
So,
I hope I told the same
shared
story.
The same stories.
Oh,
So excellent. So we do have time for a couple of questions from the audience. Any questions, thoughts, comments? Dr. Wyckoff?
Yes,
So it seems like after the merger, the biggest challenge you're going to face is still the Medicare wage index. Because our cost of living may be lower, but your cost of supplies and insurance is the same as everyone in the country.
Right.
Is there anything you can do to renegotiate that with Medicare?
well, there are efforts going on. Actually, we're happy that a number of legislators have come on board at the federal level to support legislation, which is what we require to redesign the approach to the area wage index. It's a very political process, as you can imagine. Any change that would increase our wage index probably means taking away from somebody else.
That's okay.
Like California and New York and states that have a lot of votes and a lot of power politically. So it's a challenging process, but I think they're beginning to see it's just ridiculously out of whack. And adding insult to injury is that that division grows every year. In this case, the rich do get richer, and we get poorer every year.
And we're also one of the oldest areas in the country by
That's
average
right.
age, so you're increasingly reliant on Medicare and similar programs.
Exactly, right. Yeah, 55% of our revenue comes from Medicare. Of course, it's for elderly and disabled folks. If we're in Charlotte, that number might be more like 40%. That'd make a huge difference for us. Anybody else? I'll be happy to stick around if anybody would like to talk privately. But,
So Mr. Neal said that he's going to have a lot of work to do after the merger is approved. So this
Yeah.
is for the coffee.
Oh, yeah,
Because you're going
thank
to need
you.
a lot of
Perfect.
coffee during those meetings,
Absolutely.
and hopefully by that point without the attorneys in the room.
Yeah, that would be nice.
So Mr. Neal is actually giving us additional time. He will be with us, for the rest of the morning. He will be here for some time if you have questions that you'd like to ask, one-on-one. I know some folks don't like to speak in a large room like this. And then students, MPH students and health administration, if you can please join us in the department for a networking opportunity with Mr. Neal, that would be great also. So thank you all, and we will see you at the next breakfast with the experts. Thanks.
Thank you.